Today, we are going to look at a BodyViz brain builder about coronary circulation and intracoronary stents. The blood vessels supplying the heart with oxygen and nutrients are termed the coronary arteries. The right and left coronary arteries, which supply the epicardium and myocardium with nutrients, are the first vessels to branch off of the ascending aorta as it leaves the left ventricle of the heart. The atrial branches of the coronary circulation are very difficult to see during cadaver dissection. However, the ventricular branches are easily visualized. The anatomy of and branches off of the right and left coronary arteries differ considerably. We're going to look at both the right and left coronary arteries and their branches, starting with the right. The right coronary artery branches off of the ascending aorta at the right aortic sinus. Typically, the right coronary artery supplies blood to the right atrium, most of the right ventricle, the diaphragmatic surface of the left ventricle, the sinoatrial and atrioventricular nodes, and the posterior 1/3 of the intraventricular septum. The branches of the right coronary artery are the atrial coronary artery, right marginal coronary artery, and the posterior intraventricular coronary artery. The left coronary artery branches off of the ascending aorta at the left aortic sinus. The left coronary artery supplies most of the left atrium and left ventricle with blood, including the sinoatrial and intraventricular nodes. The branches of the left coronary artery include the anterior intraventricular coronary artery, circumflex coronary artery, and the left marginal coronary artery, which is present in most individuals. Coronary artery disease, abbreviated as CAD, or sometimes called coronary heart disease, is a preventable disease with dangerous thickening and narrowing of the coronary arteries, which disrupts the flow of oxygen and nutrients to the heart, causing serious problems. Without enough blood, coronary artery disease can lead to angina, which is chest pain. Over time, the heart has to work harder, possibly causing heart failure, which is when the heart cannot pump efficiently, or arrhythmia, which is when the heart beats irregularly or too quickly. The damaged arteries may become completely blocked or become prone to clotting, causing a heart attack. Next, we will look at the symptoms, causes, and treatments for coronary artery disease, and finally, give a patient example. Symptoms may either be absent or unnoticed until the blockage significantly reduces blood flow to one or more portions of the heart. Then, upon exertion, the individual may experience angina, which is chest pain, shortness of breath, fatigue, or a heart attack. The typical cause of coronary artery disease is the deposition of cholesterol, also known as plaque, in coronary arteries over a prolonged period of time, often accompanied by inflammation. One of the most common forms of treatment to a blocked coronary artery is angioplasty, followed by the insertion of a small wire mesh tube, termed a stent, into the coronary artery. Angioplasty is performed by inserting a thin guide wire into an artery of the arm or thigh. A small catheter is then inserted into the vessel and guided along the guide wire to the heart, while the physician monitors the progression of the catheter by X-ray. A dye will then be injected through the catheter in order to determine which coronary arteries are obstructed and by how much. If angioplasty is needed, a small balloon, often accompanied by a stent, will be inserted into the obstructed artery and inflated, breaking up the plaque. The plaque segments are then removed by section. The stent is then inserted into the area of the obstruction in an effort to improve blood flow through the coronary artery by preventing a narrowing of the coronary artery. Coronary angioplasty and the insertion of a stent should decrease the patient's symptoms, and the patient should experience a better quality of life. However, CAD will not go away, and the patient needs to significantly alter their lifestyle in an effort to reduce the continued progression of coronary artery disease. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age, 81. sex, male, chief complaints, chest pain, and fatigue. You invite the patient into your office for an examination. Lately, your patient has been experiencing sharp pain in their chest and feeling a lot of chest pressure. The patient has also noticed a drastic decrease in their energy level. Your patient has a history of high blood pressure and high cholesterol. Based on your patient's age, medical history, and chief complaints, you suspect some sort of coronary artery disease. You send for some testing, including an EKG, which shows an elevated heart rate and also indicates that your patient has possibly had a heart attack recently that they may have been unaware of. You want further imaging, so you send for a heart CT scan, which can show any plaque building up and blockages in the coronary arteries. Based on the cardiac CT, you notice narrowing of the coronary arteries and diagnose your patient with CAD. You recommend immediate surgery as your patient is at high risk for another heart attack. You perform the operation, which consists of angioplasty, followed by the insertion of a small wire mesh tube, called a stent, into the coronary artery to prevent any further narrowing of the artery. This is a classic example of CAD and intracoronary stents. Thank you for watching this Brain Builder video. Please like and subscribe to our BodyViz channel. Or if you're new at BodyViz, check out our other anatomy resources and schedule a demo at bodyviz.com.